My name is Catherine Carlton. I'm Executive Director of Orchestras Canada, Orchestra Canada, and it's my great pleasure to welcome you to today's webinar. I want to start by acknowledging that Orchestras Canada is privileged to work on the traditional lands of the Mississauga Anishinaabe people on the lands formerly known and currently honored as Nogojiwanong, the place at the bottom of the rapids. So delighted to be here today. I'd like as well to introduce our distinguished speaker for today. You know, anytime there's a conversation about health and safety in the performing arts, the name Janet Sellery is mentioned. And it's such a thrill to me to get to encounter someone who is not only a renowned expert, but also one of the most thoughtful and considering people that I've encountered. Janet spent many years, 14 of them in fact, as a working stage manager. Her resume includes over 30 productions at the Stratford Festival and many others for theaters across Canada. Any of you who've worked with a good stage manager know that a wonderful combination of calm and toughness that characterizes the great ones. And I think that is really what Janet is all about. Before opening her own consultancy, Janet spent 9 years pioneering a health and safety program for the Stratford Festival, now recognized as the gold standard for theaters and performing venues across Canada. She's also consulted for Safe Stages Alberta and Play It Safe, a safety manual for school theaters and studios in British Columbia, and is an active volunteer in the community, serving as a volunteer member for the Live Performance Health and Safety Advisory Committee for the Ontario Ministry of Labour, the Event Safety Alliance Advisory Council, and the Event Safety Working Group. She is a lauded member of Canada's performing arts community, and I can't think of a better person to lead us on today's exploration of safe reopening, risk management, and all the things that we need to be thinking about from our various perspectives as orchestra and performing arts people, keen to get to work again, but keen to get back to work safely with due care for all of our constituents and the people we love and the art that we care for so much. Janet, no further words from me. Over to you. Thank you so much and welcome everyone.
Thank you, Catherine. I'm so delighted to see all your smiling faces. It looks like we've got coast to coast to coast represented. So I'm going to jump in and begin to share my screen. And here we go. Just going to ask for a quick confirmation that that's come through okay. We're looking good? Right, I'm gonna, Catherine, can you see the screen okay? Let me know if you can't. All right, I'm gonna assume we're good to go. All right, so I'm gonna start off with a quick disclaimer because I want to just make sure that we have a clear understanding of where I'm coming from. And I caution you, first of all, that I'm not a lawyer, doctor, or public health expert. And every day we're seeing that our understanding of COVID-19 is changing. So this conversation is for information only, and you need to comply with all the requirements that apply to your specific circumstances. Je suis désolée de ne pas parler français. There is a translation of the slides, which you can jump out and refer to. They have been sent out as a link. The other thing you should know about me is that I'm not a musician. I wish I was. However, music has a very important place in the life of our family. So I'm going to ask for Royden to take the control of the launch pad, and we're going to do a few polls just so that we can get to know each other a little better. So I'm going to stop sharing my screen. I don't know if I need to do that. Maybe I don't. Royden, can you just give me a yes or a no? Do I need to stop sharing my screen?
I think you should be okay. I can launch the polls when you want them to, Janet.
Okay, hit it, Royden. Royden is the one who's keeping all of this, these goodies on track for us. So the reason we're posting some polls is we'd really like to get to know who's joining us today. So you should see a poll pop up which will ask where you are, so we can get a view of who's joining us and from where. So you've got an opportunity just to choose your place, and it's kind of fun to watch as all the numbers start coming in. I see that we have representation filling in from British Columbia all the way through to our Atlantic provinces. Give it just a second. It looks like we may have, people may have completed that. 93% have voted. All right, so let's end that poll and welcome people through from all the way from BC all the way to our Atlantic provinces. We're not seeing anyone from Saskatchewan or the territories as yet, but who knows, they may yet pop in. So let's move on to our next poll. And this next poll is going to allow us to get a little better sense of who's in the group. And there it comes. So this is what we're looking to find out. What is your main role? So we're seeing a variety of different people who have looked at the topic and found that it might be valuable to them. Definitely skewing more towards the leadership side, executive directors, general managers, but I'm delighted to see that we do have representation coming in from musicians, musical directors, and administrative staff, with a few other folks on the production management, technical direction side, and even someone from front of house. So we'll give that a little bit more time to play out, but you can get a sense of who you're sharing your Zoom tiles with. All right, I think that's great. Let's end that one, Royden, and then as soon as you're ready, we can move on to the next. All right. So our next poll is looking to discover what the reopening status is where you work. So many of you will be in a situation where you're closed and you're making some plans to reopen. Depending on where you're located, you may be partially reopened. You may have some activities you can carry out, but you're not as yet inviting patrons. And in other parts of the country, there are orchestras who are able to open with some activities and some patrons, and a very small number who are able to be fully open. So the numbers are still coming in, but at the moment, we're seeing most places sort of hovering around 55% are closed and making plans to reopen. We do have a couple of places that are fully open and then a bunch in between. Excellent. Thank you, Royden. Let's have a, yeah, so again, we're able to move on to our next poll. And this one is about how you're feeling. So we've been through a very, very unusual 6 months, and I'd like you just to sort of have a look at those words and see what sort of resonate with you. There's a lot of big feelings that go hand in hand with the kind of obstacles that we've been facing down in the last few months. And you know, when we look towards reopening, we want to be excited, but there's certainly a pretty high level of concern. So I think you'll probably, you know, look at that and be able to see something of each of those descriptions in what you feel from one day to the next. Overwhelmingly, we're seeing that people are feeling concerned. There's a pretty high level of stress. But we can see that balanced out by, again, quite a bit of optimism. I'm very happy to see that. Some excitement, some confidence. So I'm hoping that as we talk through our time together today, that we will maybe be able to help you with, you know, feeling more confident, feeling more optimistic. So that's I think, a good number. Let's end that one. And yeah, so top of the pops is concerned at the moment, but we are still seeing some good optimistic feelings out there. let's move along to our next poll. All right. And I'm curious to know how many people attended part one of this. Chris Walrath put together a really excellent session, which I couldn't attend in person. I needed to look to the recording for that one. So I think you'll find that what I'm doing is sort of focusing in on some of the topics that he covered, and very much on the same song sheet. You know, I'm really pleased with what he was communicating with you. So, what a great number. So 63% have attended. So it's not a problem if you haven't, but you might wish to go back and listen to that recording. And let's end this one. And I think I've lost track of my numbers, but I think we just have one more that we'll do for now. All right, and this one is just for fun. I used to like going to seminars and things because there would be snacks. So if we could offer snacks today, you can scroll down. There's even some that you can't see from the first in the first list. So you can just move that little bar on the right down. Tell us what kind of snacks you would like, and Royden, who is taking care of all the hard bits today, will be deploying the Orchestras Canada fleet of drones to make deliveries once we hit our break. So if you scroll down a little bit, I'm not sure if there's a way for us to see it, but there is a good one at the, oh, there you go. Oh, some people have found the deep fried Mars bars at the bottom. Very pleased to see that. We've got an overwhelmingly healthy bunch. I'm impressed. Maybe we've all gone past the deep fried Mars bars and come around back to the fruit and veggies and hummus. That would be a very good thing. I should do more of that. Okay, so let's end the poll and see what the top snack was. The veggie tray and hummus and pita for a tie. Well done. Okay, so that's just to give me a moment to kind of get to know you guys a little bit. And so hopefully that's a little bit interesting for you. And I'm going to carry on now.
Okay, one quick word, Janet,
Yes.
if you would be so kind as to press use slideshow. That way we don't get to see your top secret notes to yourself.
Oh my goodness. How come I'm showing that? Thank you.
I think at the top of the screen there, in the upper left-hand corner, there's something that says use slideshow. I'm wondering if that might be it.
Oh, that's interesting. Oh, let's try that. Is that any better? Did I get it?
Nope.
No. Darn. Okay, it's showing this way for me. Always. Okay, I'm going to stop the share. Sorry about this, everybody. I'm going to dig back in. Let's try this one. Any better?
Perfect.
Okay.
Thank you so much.
Thank you for your patience.
We've got the big print for those of us with challenged vision. That's great. Thank you.
Yes. And you know what? As a technician, I'm a better stage manager. Let's just put it that way. All right. So what are we going to talk about today? Let's move on to our agenda. So we've got a list of topics that I'm going to cover. I want you particularly to note that there will be a break of 15 minutes. And there will be follow-up information available to you. Some of it is already posted. In fact, most of it is probably already posted. The PowerPoint, so if you're a note taker, feel free to take lots of notes, but you will receive everything that's on the slides. There is a document called COVID-19 Response Planning and a Sample Risk Assessment. And as well, I have just this morning sent off to Catherine a reopening resources list. Now that is something that's a movable feast. I was adding a couple of things to it this morning, but it's just some of the things that I feel are useful. You will see that some of them are not about orchestras. Some of them are about museums and galleries and film and television, but each of them is a link that I think you might find some interesting ideas in that you may be able to translate to your own situation. So as we go along, please post any questions or comments into the chat. I have a couple of places within the presentation where I will be asking Catherine to pass me along the questions that you've been posting. You can also put comments and so on. I won't be watching the chat as it scrolls by, so you can say whatever you like. It won't make me cry. I also have several activities planned. So I know that 3 hours is a very long time for us to be together, but I wanted to have that time so you could carry out some activities with your peers. And so you will be heading into breakout rooms for 2 periods of about 15 minutes each, where you can talk to each other and reflect on some of the information. And then there'll be a couple of opportunities towards the end to provide some individual reflections as well. All right. So this is what I call a how to plan conversation. It's not a when or if we'll reopen, which are very different things that are outside of my control and yours for the most part. Also, I'm not going to address all of the regional specifics because there are lots of them and they are changing day by day. There are some things that we do know. First of all, that COVID-19 is a pesky virus spread through respiratory droplets and aerosol. It's highly infectious, causes mild to severe illness and death, and currently there is no vaccine. There are many unknowns still about this virus, but we do know that spending time together spreads it. This is the first disease to widely close businesses since the Spanish flu in 1918. But what I want us to hold on to is that much of the best ever theater and poetry was written during the 30 years when theaters were closed 40% of the time due to the plagues. And I'm sure the same would have been true for music. Despite these closures, this can be a richly creative and innovative time. And I want to acknowledge the excellent work being done by our arts service organizations and our individual companies, and all of the subgroups and friend groups and colleague groups who have really gotten together to figure out ways for all of us to get through this time. Before we talk about your orchestras, I want to take just a moment to talk about you. We are all feeling very big feelings, and they change day by day. And I've posted a quote that reflects how I've been feeling lately. It may be very different for you, and that's okay. But most of us are dealing with some combination of concerns about money, about purpose, about the future. And many people are also thinking about caring for elderly relatives and figuring out what back to school means for their families. So we need to recognize that because it's part of the picture as we begin to move towards reopening. I have had 4 words that I've been using to guide my life for the past few months. I think first and foremost every day that I need to cope, and you will need to do that too. Take care of yourself and your loved ones, and ask for help when you need it. The second thing I try to do is I try to help. So for a while I was making meals for a friend who's working in frontline healthcare. I've been trying to support elderly parents. With anything, any even little things, even getting your, that time back in March when you were teaching your elderly parents how to work Zoom. Those are all good things. They're all rewarding things. And work is often taking place from our homes. So we need to adapt to that. And we also still, even though it's been a while, we need to reduce our expectations about productivity. The final thing that I find really helpful is to learn. I'm really focusing on professional and personal development, including new skills that I can use for enjoyment. I have never baked so much since we began this peculiar time. We have some priorities when we look towards reopening, and I've boiled them down to 2 things that I think are critically important. The first one is we must keep our musicians, workers, volunteers healthy and safe. And second, we need to create environments where our patrons feel confident to return. And this requires something of a social contract. It's not, the printed contract you're going to sign your name to, but that kind of agreement where everyone agrees that we're going to take some precautions to protect each other. And Canada has been doing a very good job with this, but we need to continue. We're at a point in history where effective health and safety protocols will be the most important factor in successful reopening. For now, workplace health and safety and public health are equally critical. You simply cannot have one without the other. Also, we can't expect our patrons to return with confidence until we've taken the precautions to protect our musicians, workers, and volunteers. And I want to pause just to remind everybody that this pandemic has not affected everyone equally. People who are marginalized experience a much more difficult time, and they are at greater risk for serious illness. One of the things I hope that will come out of this time is that we take the opportunity to reflect and improve our organizations. I strongly encourage you to participate in learning opportunities related to things like anti-racism, equity, diversity, and inclusion. This will make our organizations stronger when we are able to return in full. And most of all, let's focus on musicians. So here's a couple of pictures from Orchestre, sorry, my French is appalling, Metropolitain, and the Hong Kong Symphonique. We can see some of the precautions that they're taking with respect to spreading players out. We've got some barriers, we've got some masks. And all of this is really important. I feel concern, and I've heard from some of the groups that I've been talking to, that some artists and musicians feel a bit left out of the process when the focus seems to be on venue capacities and revenue. It's really vital that we enable artists to practice their craft and create. So as much as we do want to get performances happening, we need to make sure that we're supporting people in maintaining their musical skills and their passion. All right, so now we're going to take a bit of a dive into some of the legislation. First, we're going to start off with a bit of the occupational health and safety law. Here in Canada, we have a lot of different law that relates to the arts, but very little is arts specific. We are divided up into 14 different jurisdictions for health and safety law. So that means that each province, territory, and the federally regulated workplaces have a different set of legislation. When we look at all of these laws, it's important to keep in mind that these requirements are minimum requirements, and reasonable practices will often exceed what the law requires. We have to think about COVID-19 as an occupational health and safety hazard, just like we would think about hazardous materials, slips, trips, and falls, or working at height. This is a hazard. We need to address it. In each jurisdiction, these rights may be referred to in a slightly different way, but fundamentally, we all have three basic rights: the right to participate in any kind of activity that affects our health and safety, the right to know about hazards of our jobs and how we're protected. And this means that we need to be trained and have appropriate information. And we also have the right to refuse unsafe work. And this includes the right to be free from reprisal. So we are protected against being disciplined, fired, etc., for using our health and safety rights. And inevitably, when we have rights, we also have responsibilities. And these are laid out in great detail in all of our different occupational health and safety acts, codes, and regulations. But they boil down to three main roles. The first one is the employer, who is obligated to provide a healthy and safe workplace. The second is a supervisor, who has to take all precautions necessary to protect the workers in their areas of responsibilities. And each worker must take reasonable care to protect themselves and others. In terms of, sort of putting that out into how we implement that, the employer has a duty to develop a health and safety program and to provide the resources, whether that means equipment or training, to implement that health and safety program. Each supervisor, first and foremost, needs to be a role model. If there's a requirement to follow procedure or wear a mask or, provide information for contact tracing, the supervisor must be compliant because that shows everyone else what the expectation is. Supervisors are really important in terms of implementing health and safety procedures, and they also have an obligation to do enforcement to make sure that those procedures are followed within their areas of responsibility. And when it comes to workers, and with that I include volunteers, the worker duties include compliance. So if there's a rule, you follow it, and reporting. If you spot a hazard, if there's an injury or an incident, you need to report that to your supervisor. So a worker isn't always a term that we think of when we think of musicians, but every single person who gets paid, and hopefully everyone in this call does get paid, is a worker under occupational health and safety legislation. I encourage everyone to treat their volunteers in exactly the same way, because we also have a general duty of care for anyone who's going to be on our premises. So in days past, and by past I mean February and backwards, our focus was often very much on safety. But in the context of COVID-19, we have to expand our thinking because employers have a duty to provide a healthy workplace too. So that was all about occupational health and safety legislation. But when it comes to COVID-19, all of a sudden we need to be really focused on public health legislation as well. The legislation around public health is issued by a variety of different parties. At the federal level, we're seeing things like border closures. And at the provincial or regional level, we'll see things like restrictions on businesses that can open and how public spaces can be used. And in municipalities, we may see some bylaws which refer to, say, mandatory masks and face coverings. So we are working with a little bit of a patchwork across the country. Some of this may be a little bit puzzling and hard to keep up with, but the good thing is it does allow parts of the country that have had very few cases to respond to that situation, whereas countries that provinces that have had more infections may need to be more restrictive. And as we know with this pandemic, those changes we went through a period of very, very rapid shutdown, and then different places have been able to reopen in slightly different ways at slightly different paces, depending on the location. So it's really important for each of you to identify the requirements that apply to your orchestra based on your location. So what kinds of things can we see in terms of public health that are going to be relevant for your orchestras? The first one is going to be physical distancing. I know we've all seen the signs, the labels, the radio ads, everything, 2 meters with some limited exceptions. We're also seeing each jurisdiction come up with some way that we can gather now in small groups. In Ontario, these are called social circles. We're also seeing them referred to as bubbles or cohorts. So what these small groups are is they're small groups of people, sometimes in the neighborhood of around 10 people, who can interact regularly without staying 2 meters apart. So this is usually going to be our immediate families, people's in our households. We may also be able to include some other relatives or close friends. And that's going to be very much individual depending on, where's your family located? Perhaps your family is spread out quite widely, so you may choose to have your small group include some close friends, maybe even neighbors instead. When we're part of a small group, we need to be careful that we have little to no close contact with people outside the group. And the reason for that is that we want to avoid being sick first and foremost, but we also want to enable contact tracing if someone does get sick. So we can track that back and figure out who may need to be informed, tested, or take the step of isolation. The reason I mention these small groups is there may be some opportunities for establishing some small groups within your orchestra. where you may, look at your restrictions where you are, and you may be able to say, you know what, we can have a small ensemble that will be sort of formally identified as a small group that would not have to be staying 2 meters apart. Now, we also see other types of small groups, and I'm going to use for an example Alberta. So Alberta has an opportunity to form cohorts, and there are 3 different types of cohorts. The one that's really important for us is that performers can have a cohort of up to 50 people. These are also available to sports teams, also at 50, and childcare programs of up to 30. In order to reduce your chances of infection, it's good for you to limit the number of cohorts you belong to. Interacting with the same people and the same cohorts will be a lot safer than constantly changing the people you interact with. So let's have a look at what that looks like. I put together this little illustration because in the Alberta example, you can see in the middle, we have a core cohort, and that would be the immediate family or household, a very small group of people, maybe up to about 10 people. Now, within that cohort, we may also belong to other cohorts. The one on the top left is our performers cohort. On the right, you can see sports, and on the bottom, we've got childcare. So it becomes very clear that joining another cohort now means that our core cohort, our immediate family, is going to have exposure to all of the other people in those various cohorts, plus all of the core cohorts of the individuals within that cohort. That feels like a voice warm-up to me. So you can be part of both a household core cohort and a performance cohort if you and everybody within that group are comfortable with the risks involved. Now, you may not be comfortable with those kinds of risks, and that's going to be very, very individual. If you have someone in your family with a pre-existing medical condition, if you have someone in your core cohort or small group who is elderly and may be vulnerable, you may need to make decisions about how many other people you interact with. So this is very much an individual kind of decision that we need to be respecting among the people who will be members of our orchestra or any ensembles drawn from those orchestras. So let's look at other types of restrictions that we may see under public health. So this is just some examples. It's not limited to these ones, but in most jurisdictions, we will see restrictions on gathering sizes. They're often going to be different, whether they're indoors or outdoors. We're seeing some restrictions around bars and nightclubs. British Columbia has just had an uptick of cases, and you probably saw in the news that yesterday they are ordering their nightclubs and their banquet halls to close. They're also restricting the serving of alcohol. I think it cuts off at like 10 p.m. now. We are likely to see restrictions on major festivals and concerts, large conferences, trade shows, and events. These are likely to be restricted for a long time to come. Those big outdoor sort of general admission audiences are tremendously problematic. Conferences where a lot of people are going between sessions and moving through corridors, trade shows where you may have a lot of booths and a lot of people close together. These are all going to be very problematic groups to deal with. In some places, you may see some requirements to separate artists from the audience using a barrier and/or distance. Ontario is in a bit of a tricky spot because the government of Ontario requires a barrier between the audience and the orchestra, between any singer and any player of wind or brass instruments. That has been clarified. There had been some other guidance out that other organizations were publishing saying that that it could be a barrier or distance, and that is not the case. Ontario at present requires a barrier. You may also see some requirements to separate artists from each other using barriers, and this would be typically around singing and playing wind and brass instruments. We're also seeing, unfortunately, a fair number of restrictions on live music. The concern is around singing in those wind instruments, which are considered at present to be high-risk activities. The reason behind that is that infection is likely to spread through respiratory droplets and aerosols. But at present, there is no evidence to determine exactly what a safe distance would be. We know that greater distances can reduce risk, and so that's kind of where we're at in terms of where these restrictions are coming from. And just to clarify that a little bit, there's one study that I want to talk to you about. I'm not going to review all of the research that's currently underway, but Orchestras Canada has an excellent list of resources that I encourage you to have a look at. Now, the reason I'm bringing this one to your attention is this is information from an observational study report from the Centers for Disease Control and Prevention in the US. This is the one that has sort of led the general public to the understanding that singing in a choir can be extremely dangerous. But let's look at it a little bit more closely. So it's based on an incident from last March. And what we can see from the illustration is that we had one person who was infected with COVID-19. That's indicated in red. Following a 2.5-hour choir practice attended by 61 people, including that symptomatic index patient in red, there were 32 confirmed and 20 probable secondary cases. So those are the ones that are in yellow. So of that entire group, only the ones in white did not become infected. While some were confirmed and some were probable, that's how many people got sick, which was an attack rate of anywhere from 53.3% to 86.7%. 3 of those patients were hospitalized and 2 of them died. So that was a very early, very shocking case. So what this outbreak indicates is that the virus might be highly transmissible in certain settings, including those group singing events. Now, it's important to realize that multiple sources of transmission may have contributed to the disease spread. So aside from just simply singing, they were also in prolonged close contact, they were touching common objects, and they were also sharing food. So this was a useful study because it underscores the importance of physical distancing, including maintaining 6 feet between persons, avoiding group gatherings in crowded places, wearing cloth face coverings in public settings. So, you know, it was a useful study, and it does suggest a potential risk from singing and playing wind instruments, but the magnitude remains unclear. In the midst of this pandemic, public health is recommending caution, and that's why we're seeing the restrictions. There is still much to do in terms of research, in terms of really trying to button down what are the actual distances that are needed. But that's, you know, when you hear all the concern about singing and about musicians, that's, in my view, that's where that began. So I want to talk to you now about how we begin to manage all of the new precautions we're going to need within the workplace. So I want to spend a moment talking to you about a COVID-19 role. So it was very interesting to me to see how quickly the UK came up with these beautiful high-vis vests that were telling people they should physically distance 2 meters apart. I am not suggesting that anyone needs to go out and buy one of these vests, but I did think it was intriguing that they're available to purchase so quickly. So when it comes to having a role related to COVID-19, there are currently no legislated requirements, but we are seeing a number of pieces of guidance that do recommend that one person be assigned to take the lead on dealing with COVID-19. Within the ESA reopening guide, the Event Safety Alliance reopening guide, they describe an infection mitigation coordinator. IATSE Stagecraft Guide calls it a COVID compliance officer, and the Canadian Association of Exposition Managers describes a health and safety point person. So you're going to see this role kind of titled and described in a variety of different ways. But here is some information that, that I would like you to think about. So again, I'm re-emphasizing it's not legislated. It's not required. But I do encourage you to have someone within your organization who will work closely with the venue, who will be accessible during all working hours. Doesn't have to be the same person. They could train an alternate to cover off, perhaps cover off certain rehearsals or cover off other times of work. They need to have appropriate medical and risk management knowledge. That does not mean that they need to be a doctor or a public health expert, but depending on the precautions that you're introducing, they need to have appropriate knowledge. For example, if you choose, and I'm not suggesting I recommend this for everybody, but if you choose to do temperature scanning, you need to have someone who is trained how to use that measuring equipment, how to calibrate it, how to know what to do when someone comes up with a temperature that raises concern about infection. If in some distant future we get into testing, personally, I don't think anybody should look to Janet to do their test unless I have sufficient training. So we're really looking to have someone who is appropriately knowledgeable in the things that your orchestra is planning to do. It needs to be someone with the skills to plan, coordinate, communicate, develop, and train and implement all of these protocols. And really important that they have the authority to enforce compliance. When you are bringing your musicians back to work, you'll need to make sure they're trained in advance, and you'll need to make sure that they agree to follow all of the protocols. This is no time for people to think that somehow they are outside of this. There is no person who gets to come to work and do what they please. It is much too serious for that. So those are some ideas about what that role would entail. There are no experts yet. Keep that in mind. There's a lot of us who are looking at all the information, trying to figure things out, but you are the experts for your own organizations. You know how your orchestra operates. You know what's important to your players. When it comes to a role like this, it can absolutely be an existing staff member. Ideally, it should be a focused role, not an add-on to another role. But that entirely depends on what the workload is right now. I include the note that this should not be the stage manager for your show. Having spoken to members of Canadian Actors Equity Association and the huge concern about stage managers, that this will be something that gets added to what they're supposed to do. It doesn't mean it can't be a stage manager. A stage manager would be really excellent at this role, but it shouldn't be the one who's actually doing your show. So that's just something to think about how you're going to organize your response. All right, so now we come to an idea that I've been sort of rattling around with, and I'm going to ask Royden to put the link to a document into the chat. This document that I've prepared is a spreadsheet where you can look at COVID-19 response planning. And what we're going to do with this spreadsheet, and you will have it to take away if it's useful within your orchestra, I want you to look at the different types of tasks that are available that may need to be done. They include things like planning, risk assessment, venue assessment, and programming assessment. They include policies and procedures, which would generally be the ones for everybody. So everybody may need to, do hand washing and hand sanitizing, but then we'll also have some departmental procedures. What do musicians specifically need to do? Where do we need procedures to support their work? Where do we need procedures to support front of house, back of house, communications, all of those things? I've also made some notes about reflecting on time, people, and money. How much is this going to take in terms of time? What do we have to schedule differently? Do we need additional staff maybe if we're going to do a lot more cleaning? And what's the money side? What do we have to budget to make sure that we are fully equipped when we want to reopen? And I've included some notes about communication and training, as well as the need to monitor and evaluate. So I'm going to take you through one more slide to introduce this activity, which you're going to be engaging in. And once I've gone through that, then I will be asking Royden to share his screen, and he will show you the chart. Once you've had a look at that, we look at it together, then we're going to send you into breakout rooms, which will be in the range of up to 6 people. And you are going to have a chance to talk with your colleagues about how to work with this information. So here's the info. So here's the instructions. Once you get sent to your breakout room, I'd like you to introduce yourselves briefly, get an idea. You may already know each other, which is great, or this may be an opportunity to meet somebody new, which is also great. Choose someone within your group to fill in the Google Sheet for your group number. So when I ask Royden to share his screen, what you're going to see is a sheet, like a big spreadsheet. It's got a couple of templates at the beginning, French and English, which we'll keep blank. And then we've got a whole bunch of sheets that are numbered with groups. So you'll need to remember what your group number is. And if you're group number 6, you go and find sheet number 6, and you can have one person who's jotting information in. I'm going to ask you each to pick a scenario. So within your group, you may want to think about in your mind a particular orchestra. It could be a venue. It's entirely what's up to you guys. So take a couple of minutes to figure that out. You may want to talk about a gigantic orchestra with a huge number of different staff members on their org chart. Or you may think, you know what, let's talk about something that's sort of a bit smaller, that may have very, very few full-time staff, or maybe most of the staff have been laid off. You're going to identify who should be involved with each task. Now, I'm going to give you a pause right here. You are not expected to go through the entire spreadsheet. I want you to look at it, and I want you to pick a few things. And I really want you to focus on some items where musicians should be consulted. So there are certain things where you go, okay, we shouldn't get too far down this path without talking to our musicians about how this will affect them and taking their feedback, okay? So again, remember your group number. I will pop into some of the breakout rooms to say hello and see if you have any questions. We're going to give you about 15 minutes. And so I'm going to ask Royden now to share his screen. And I'm not entirely sure. I think I need to stop sharing. So I'm going to stop sharing. And we're going to let Royden come up with this beautiful thing.
Very small.
Is it very small? Okay, well, it's probably just needing to, you might want to check that you've got your sheet into full, they're up in the top right corner. You can go to full screen. Okay, I can see that, and I hope that you guys can see it too. I see some faces now. Can a couple of people just give me a little nod if you can see that spreadsheet? Excellent, hurrah, hurrah.
Yep.
Okay, so I'm going to talk you through it. So we've got at the top left, we've got a yellow box called scenario. So you can put something in there. It could be big gigantic venue, or little boutique orchestra, or whatever you want that to be. You can see there's a list under description. It is headed with planning, risk assessment, venue assessment, all of those different things. And you can see across the top, I've made a list of the people or the departments who you may have as part of your orchestra. Some of you may have more, some of you may have less. You may not at this point have a COVID-19, I've called it a compliance manager, but it's whatever that role is going to be. There may be some of these that are combined. So you may have chosen to have your admin person will be your compliance manager. You may not have anyone from front of house at this moment. That's cool. So I'm just going to give you a little example about how this might work. And don't feel you need to go through all this, because I wanted this to be a takeaway that you can use as a tool when you get back to your own orchestra. But if we look at row 4, which is under planning, it's assign roles. So we have several different assignments that we can do. At the top, the legend shows you an L for lead, a C for consult, R for review, I for implement, and NA for not applicable. So if I were going to look at assign roles, I would put an L under employer. So that's the person who should say, who's going to do all this stuff? Whether it's the executive director, general manager, producer, can be any name, but whoever is the tip top of your org chart, whoever is le grand fromage, that's the person who would be there. So I would put an L there. Then if I were to go down to say row 7, so at row 6, I've given a list of review organizational priorities. So while you're on hold, you may choose to go back to some of these topics that you have wanted to either begin to do some work on, or you may want to review or bolster them. If I were to take accessibility as an example in row 7, I may choose to say that front of house is going to lead work on accessibility, but then they will need to consult with production, facilities, musicians, and so on. So there may be certain people they will consult as they work on that. Once the work is complete, they will issue it so that other people in the organization can review it. But it may be that some of the implementation will actually fall to facilities. And I'm not trying to make this super confusing for you, but I just want you to have an opportunity to talk about some of these things you might do. Down on number 13, consult with venue clients and renters. Think about who might be the right person to lead that. And then you may need to consult with other people in your organization. When it comes to risk assessment, think about including the people who you are doing the risk assessment who are covered off. So I would always feel that if I were going to do a risk assessment, I would want to consult with the musicians on theirs, right? That's going to be much more valuable. And Royden has thankfully, he's reading my mind at a distance. He's very clever that way. He's showing you that there's another heading for venue assessment. There's one about program assessment. And then we go on to that sort of general types of policies and procedures, some departmental things, and then the time, people, money question. At the bottom with communication and training. We're going to have a variety of different types of training we need to do and educate our patrons. And we need to think also about procurement. If we're going to need to be putting any barriers up or marking our venue with signs and floor markings and so on, PPE, whether that's cloth face coverings or whether we need to get into some specialty masks. We may decide for front of house, we want ones with a little window so that we can see patrons, or anyone who has loss of hearing can lip read. That may be important. We may decide it's important to have specialty masks for our singers or some of our musicians. And at the bottom, I want to make sure we don't forget to monitor and evaluate, that we talk to people and find out, how did that go? Because we're all learning this right now. How does your orchestra feel about the precautions? If we try something out, what did they think? Maybe they think everything was great, but you know what? I was super uncomfortable when it was time to be on a break because we didn't have much time. We only had one washroom. It was very crowded, and we can respond to that. So does anyone have any questions before we get started? And I'll ask if Catherine sees anything that needs to be answered in the moment. Does anyone have anything?
I'm unmuting myself, and there's been some lively exchange.
Okay.
In the chat box.
I
think.
Are there any questions specifically about this activity? And we will have more time. We will have lots of time subsequently for questions. But I just want to make sure people understand that this is an activity. It's for your benefit. You're going to spend 15 minutes with a group of your peers. There is no right or wrong answer here. I know I like to know that I've done the right thing. This is an activity to do some brainstorming and to work with your colleagues. So unless there's anything specific, Royden, I'll ask you to send people to their break rooms, and you can always post a question in the chat if you're in there and you go, oh, now we don't know what to do. But I hope you do.
We'll be monitoring. Okay.
Excellent. All right. So off you go, everybody.
All right, so I'll initiate the breakout rooms, and in 15 minutes, I'll send a general message asking everyone to get ready to wrap up the conversation, and everyone will turn to the main group.
Thank you.
Here we go. Thanks, Janet.
Okay.
I think everyone's back from the rooms. Is that right, Royden?
Indeed, yep. I think we're
Okay.
good.
Hello. All right. So we are back. And I had the opportunity to pop into a couple of the rooms, not all of them, but I was just so pleased to hear the conversations that you were all having, finding areas of common concern, hopefully finding some support for the very real challenges that you're facing. I know there's a whole thing about we're all in this together, but our situations are very, very unique. And I know I find it helpful when I get to talk to someone maybe in a different part of the country who's facing something similar to me. And one of the huge good things, a huge opportunity that has come out of this time is the level of collaboration. And, you know, what Zoom is doing for us is it's kind of making it possible for us to have some conversations with people who we might wait until a conference or wait until a particular event. So hopefully you've been able to get to know some people. Hopefully the spreadsheet will be a tool you might employ in some way or another. Whether or not you actually talk through those items or not, hopefully it's something that will be useful along your way. So now I want to turn our attention to risk assessment. And one of the things I enjoyed about Chris's presentation was he talked about doing risk assessment every day, which of course just totally warms the cockles of my little heart. We all do risk assessment every day. And if you think it's something that's really complicated or that only an engineer could do, that's not the case. There are some very complicated ways and tools that we can do risk assessment, but essentially we all do risk assessment every day in one way or another. We decide if it's safe to cross the street. We look both ways. We decide when we look at the weather, whether we should take an umbrella, whether we should put on our winter boots, whether we need to throw our winter kit into the back of our car. And we also, now that we're into this whole kind of COVID-19 world, we make our choices about where to go shopping even. So I had an experience with, there's a few, I live in Stratford, there's a few grocery stores, and I went to one of them at the very beginning, and I was very pleased. There was someone at the door very visibly wiping down carts, masks available, hand sanitizer available. I see the arrows, I see the, and everyone was sort of following the rules. Now we're into masks. And so I was very comparatively comfortable shopping. I would say I am not 100% relaxed, but I was comparatively comfortable. There was something I couldn't get early on, so I went to a different grocery store, and I was extremely anxious because people were not following the arrows. It was very crowded. I went down an aisle and there were two people stocking shelves, one on each side of the aisle. And I found myself sort of just stopping and trying to decide, do I back my cart up? Do I go, squeeze past them? So each one of those little interactions is kind of a mini risk assessment. So I'm going to give you a few definitions to start off, and then we're really going to look at how we can use it as a valuable tool, which I think many of you are probably doing in some way already. So first of all, it's a systematic examination. So we'll look at a job or activity. It could be something like, unloading equipment from a truck or arriving at a venue for an audition. And we'll look at that activity and try to see if there's any potential hazards. When we've discovered a hazard, we'll try to assess the level of risk. So is this like falling off a step stool or falling off a catwalk? There's going to be different levels of severity and likelihood to both of those different activities. And then probably the most important is where this risk assessment takes us. We need to use it to identify practical measures to control that risk. And these are going to be a variety of different precautions. So when we develop our precautions, we need to think about all of the different activities that will occur along the journey of the artist, the worker, the volunteer, and the patron. So we can apply it to all of these different groups. One of the people who I've been having a lot of conversations, as you can imagine, in the past few months, and there's a planning manager at the Arts Club Theatre in Vancouver who did a webinar with me. It was a panel. And one of the things he was doing a risk assessment for his venue. And then once they had completed that risk assessment to determine what they felt they could reasonably do, they developed their programming after that. So I thought that was really interesting, because normally what we do is we decide we're going to do this particular event, and then we do a risk assessment. What he's doing now is he's doing risk assessment and deciding, okay, what kind of event can we do? So I think that's quite a useful way to look at it in these times. The great thing about risk assessment is you can scale it to suit your company. So it works for a gigantically huge company, but it also works for a very tiny volunteer ensemble. So let's look a little bit more at what the words mean. So risk assessment in its more formal way, format is a written process to look at hazards before they can cause harm. And we have a slight distinction between a hazard and a risk. So the hazard is something with potential to hurt you, whereas the risk includes the variables of likelihood. So how likely is it it's going to cause harm, combined with the potential severity. So you can see with my little illustration of the shark that we have someone standing near the beach and they can see the shark's tail out in the water. So the shark is a hazard, but once that person is swimming and the shark is right nearby with their big teeth, that's where we've got a big risk. So they're two slightly different things. The controls are all the different precautions that we take to mitigate that hazard or reduce the likelihood of an incident. And I have my little, distinction. Sometimes when we do our risk ratings, we will look at something that's minor, moderate, major, critical, sort of hair on fire. So we can look at those different variables. So let's look at the steps we take when we do a risk assessment. So the first thing is identifying a task or an activity, a job or a type of work. And in this case, I'm going to use the example of an usher. One of their tasks is to take tickets. And in the context of COVID-19, the hazard is in close contact with others. So taking tickets from patrons. One of the controls we can do is to implement no contact ticket scanners, or we can have people with their ticket on an app. There's increasingly lots and lots of options. So that's how as simple as it can be. When you do a written risk assessment, you can put it into a format that would look something like this. So for this example, I've included, it's for a production manager. We're just looking at the administrative work they do, and hazards include close contact with other people, which can be controlled by working remotely. We can get into some web conferencing, and we can, if it's at the workplace, at the office, we can limit the number of people. We can stagger our shifts and breaks. We can arrange furniture so it will maintain distances, and we can wear masks. We also looked at the potential for contact with surfaces and equipment, which can be, you know, that's a process of cleaning and disinfecting. For this, I didn't include it, but you could say that everyone has individual equipment. So we don't share a computer, we don't share a screwdriver, we have all of our own stuff. And we should also be considering the existing hazards. So they didn't all go away just because we had this little pandemic come along. One of the concerns about doing administrative work is the risk of musculoskeletal disorders, which would be our strains and sprains. And in an office setting, we will adjust the workstation to fit that worker. So we make sure that their desk is the appropriate height, that they have an adjustable chair, that they've got their monitor placed properly, that they have a comfortable keyboard and mouse. And one of the things that may happen when people are working from home is they may have been able to get permission to take some of that equipment from their office and bring it back to their home. So what you'll notice with this chart is that I have not included columns for risk ratings. So normally you would see a column in between the hazards and the controls. Now, I don't know if I can do this. Annotate. Oh, that seems very fancy. So I don't know if you can see my mouse. Maybe you can, maybe you can't.
Yep, we can see your mouse.
You can see my mouse? Hurrah, sorry. This is way more fanciness than I've done before. So between the hazards column and the controls column, typically you would see 3 more columns right in here, and one would be called likelihood. So how likely is it that this would be a problem? One would be called severity, which would be what is the scale of how serious the consequences could be? Is this something moderate, minor, moderate, major, or hair on fire critical? I have chosen not to include those columns in this situation because we have to assume at the moment that everyone is infectious and all infections are serious. So we need to take these steps regardless. So we're not going to try and quantify that in that way. So that's as simple as it can be. I'm going to move along and show you the magical hierarchy of controls. Now, last February, I would have said this was a triangle that most people were not aware of, but I'm sure all of you have seen it 100 times by now. But the beauty of the hierarchy of controls is it shows you what the most effective way to control a hazard is. And you can see from the blue at the very top, these are the most effective controls all the way down to the red, which is the least effective. So we're always aiming to eliminate a hazard. And with COVID-19, it was easily done. Lockdown, everybody stays home. So that is incredibly effective, but it's probably not sustainable for the next 2 years. So we need to look at other types of controls that will allow us to find that balance between staying home and between living our lives. Substitution is an option when you're dealing with a hazard like a hazardous material. So if we're using a chemical that's quite toxic, we can substitute another chemical that will be less toxic. And that's a very effective choice we can make. Unfortunately, when it comes to COVID-19, it is not within our slate of options to decide that this is a harmless cold instead. So we don't have that available to us. What we do have available to us are two more types of controls that are extremely effective. One of them is engineering controls, and this is where we see physical barriers such as a glass panel. The great thing about an engineering control is you put it in place and everyone who encounters that is protected. There's nothing that they have to do actively. It's a physical barrier that's in place. So we like those whenever we can find an opportunity to use them. The next group is administrative controls, which takes in a whole lot of different things like policies and procedures, our hand washing and disinfecting. We limit our gathering sizes and we implement physical distancing. Now, these are still very effective, but they do rely on people being cooperative, and they do rely sort of on a whole community deciding that those are the things we're going to do. Generally, when we look at the hierarchy of controls, we feel that PPE is our least effective way to control a hazard. Now, that doesn't mean that it's not important, but it means it should be used in combination with our other types of controls as well. So there's lots of different PPE at play in our sort of healthcare settings, but the type that is most valuable and important for us right now is our masks and face coverings. So we have the goal that wherever possible, we're going to eliminate the hazard, but if it's not possible, we need to control each hazard to a level that will present a minimal risk to worker health. And I've talked to you about the order of preference, and now I'll go into a little bit of detail about each one of them. So engineering controls physically control that hazard. We've seen different examples with different types of hazards, but this picture shows you the drive-in concert in Saskatchewan with Brett Kissel, and you can see how they have placed barriers around all the players except for their leading man. So that is going to give some separation. Also, because they're outdoors and it's a drive-in, they have a large physical separation between the musicians and all of the people who are watching from their cars. Next, we go on to administrative controls, which include safe work practices and training, scheduling, supervision, purchasing, preventive maintenance, signage. All of these are different types of controls. You can see that we've got a variety of signage here. The first sign is a skip this seat sign, which is from Act Safe in British Columbia. And on their website, they have created a whole series of free downloadable posters. You'll find a lot of that kind of printed material available on your public health websites as well. But they just happen to have some that are more performing arts oriented. So this is something that has become very, very prominent everywhere we go. All of these administrative controls can be summarized into a COVID-19 safety plan. You can describe all of these different precautions that you're taking and sort of bundle them up into one document. When it comes to our PPE, again, it's a last resort and should be used in combination with your other controls, but it's really important in terms of lessening the potential harmful effects of exposure to these hazards. And Catherine sent me this wonderful picture for a woman, who, I think it's a woman, I hope I'm right about that, Mega One Arts. There's a Facebook page, and there's tons of really, really cute different patterns for masks. So who knew that masks were going to be my greatest fashion accessory? But you know, I can change it up. One day I got polka dots, one day I got minions, one day I've got my Canada flags. So I encourage you to support another musician if you're looking for more options in your face covering wardrobe.
Absolutely. I'll just burst in here and say Catherine is a bassoonist.
Oh,
and
yes, thank you.
mask maker. And so Mega One Arts is her mask making business, and she does do custom orders, and she has sourced fabric with instrument themes.
Oh, yes. Yes.
So I'm just going to throw that out there and say that my clarinet masks from Catherine are among my proudest possessions.
I love this. Someday we'll be mask trading, of course, fully laundered and sterilized. But yeah, she's got some beautiful fabrics and lots of fun. And I don't know, I like being out at the grocery store and seeing what people have on their faces. It makes me smile.
Right, and I see that she also she was commissioned by the Sudbury Symphony to create masks that they have been selling. So
Oh,
just throw that out there. This is
genius. Let's support each other.
that's
It's
it.
a good thing.
Thank you.
Now I'm going to show you a few sort of specialized masks, which you're probably all aware of, but just want to put them out there in case anyone is not. The Broadway Relief Project has come up with an instrumentalist mask, and they've got a couple of different ones. One is front access for horns, clarinet, and saxophone, and one is side access for flute. So I'm not sure if any of the players on this call have begun to investigate those. As I said, right off the hop, I'm not a musician, so I can't suggest that these are suitable for your own specific needs, but they may well be worth considering, and they may open up some more opportunities for playing together. There's also some options in the singing mask department, also a version from Broadway Relief Project, and another one on the right, which is created by Diana Coatsworth Design. And Diana is, she's got a whole new career as a designer, but I first met her when she was a dancer at the Stratford Festival. So very, very talented, multi-talented person. So these are some things that are beginning to come out. I think a lot of these mask makers too are very much willing and interested in customizing to try and find anything that will help folks get back to what they love to do. So I just want to sum this a little bit up with the combo platter. Individual controls are always best when they are put together with others. So we can make sure that we are not just hopping only to PPE, but we're looking at all those other kinds of controls that will protect our folks. So the next thing I want to do is I want to open it up for some questions. And I'm going to stop sharing my screen, and I'll ask Catherine to bring forward some of the questions that may have been gathering and see what I can do to answer some.
Okay, so I'll just back up and say that there was a bit of a pop quiz from one of our participants who said, was asking just for a clarification around the column titles that you opted not to include. Just if we're looking to develop a complete risk management tool, we had likelihood and severity.
Yes.
But what was the third?
Sorry, I didn't say it, did I? So you typically you'll put the number in, and it's going to be one number or word, could be qualitative, about the likelihood, and the other about severity. Those get multiplied together to become a risk rating. There's also there's a document that's on, there are a bunch of different documents, which I'll show you, but one of the resources that I probably should have included that I didn't put on the list is there is a risk assessment for safety guideline for live performance in Ontario, which is on the Ministry of Labour website. And I can make sure I provide that, but I was on the group that wrote that, so it does have a little bit more detail about that. And the handout that I have sent of resources has a couple of different links that will help you further with risk assessment. That's a great question, and thank you, because I was freestyling and trying to use my my cursor, so I missed telling you the third column.
Okay, that's incredibly helpful. And then we got into a bit of an exchange about whether it was everyone or everything that was a risk, and I think we decided that it was probably both. Let me go back to one that's a little bit of an attitudinal, organizational style question.
Okay.
You know, there has been some controversy Even here in Peterborough, we've had a couple of anti-mask gatherings, and there are some people who I think are pretty much convinced that the whole thing is a scam. How might a group of people responsible for an orchestra's operations best deal with the swirl of opinion and feeling around health and safety measures, including masks, including physical distancing, etc.? What if some of your members, one or more of your members, just says, this is crazy, this is a conspiracy, I don't want to participate in this, in these health and safety measures that you are imposing? Any thoughts on
Yes,
what a
yes.
responsible organization might do?
Right. So I think we have to look at, whether or not this is an employment situation or volunteer situation, there is always, or even if you're attending a performance, there is always an agreement between the management and the worker, or the management and the volunteer, or the venue and the patron about how we are going to behave. So if you are employed, then you have, as a condition of employment, you have an obligation to follow the safety requirements that are put in place by your employer. They are not optional. If you are a volunteer, there would be some form of an agreement that you're going to participate and that you are going to follow whatever policies and procedures your organization has created. And even with a patron, you've seen every time you go to Tim Hortons, no shirts, no shoes, no service. We don't get to do whatever we want. We don't get to go to a play and take flash photos throughout that play. So is that helpful?
I think it starts to address absolutely both the distinction, or the lack of distinction between people who are paid and people who are not paid, but the idea that there is sort of a social contract.
Yes, and there should be a written contract. So everyone who signs if you're on a collective agreement, there's always going to be something about you must comply with essentially the laws of the land, but also with any requirements, reasonable requirements, that let's say your orchestra decides that the only way you're going to be able to work together is if everyone has a COVID-19 test every single day. That would need to be presented to your orchestra through whatever collective agreement or collective bargaining or negotiation that you have, and you need to come up with an agreement about that. When it comes to something like wearing a mask, like distancing, you're absolutely within your rights to say, I'm sorry, but you cannot be part of this. You cannot be part of this orchestra if you're not prepared to follow these requirements. It's harsh, but this is not something that we have the option to overlook or to provide exceptions around.
Okay, we've had a couple of fascinated questions about the masks.
Yes.
And in the chat, Holly Price from the Counterpoint Orchestra shared the link to the Broadway Relief Project's instrumentalist mask. I also noted that I ordered one on the first day that they were available, which is last Friday. I understand that it's in transit, and I'm looking forward to modeling it for anyone who wants to do a Zoom call with me. I can make terrible noises on my clarinet, and you can see how it works. But basically, how I understand it operates is that there's a slit in the middle of the mask, and there is the inner layer is a closer fitting sort of lycra material. And the idea is that if there is air leakage around my embouchure, and the mouthpiece, that the mask will help to capture that. The other thing that I have purchased, because I am possibly a loony, is a bell cover. And I will include in the chat a link to the place where I bought bell covers for my clarinets. And again, these are alleged not to change the sound, but to capture aerosols that might come out the end of the bell. And we do understand from the National Federation of High Schools research in the US that there is actually some stuff that does come out the end of the instrument as well as the holes along the way. Michael Newnham has reported that Orchestra Toronto has purchased bell covers for all brass players. And there's that. And I'm just about to let everybody know in the chat that Catherine McGowan, who's Mega One Arts, Beautiful Masks, you showed in that picture. She doesn't have a website, but she does have a Facebook page, and I'll include a link to her Facebook presence as Catherine, the mask maker of Mega One Arts. And I think that about covers the questions that have come up so far. I think we did deal with a question from Devin Scott earlier on where he was asking about the requirement for impermeable barriers in Ontario between wind players, brass players, and singers, between musicians on stage.
Right.
The Ontario regulations, as I understand them, and did have them clarified by someone at the province,
Yep.
is the requirement for an impermeable barrier is between performers and audience. It is not a legal requirement to have them between musicians. However, if you can't guarantee physical distancing, and if you are concerned about health and safety on stage, then it may be that that's a conversation that needs to happen.
And this is where I do think it's important to have some of these conversations with your musicians, right? Because we're not only looking for stuff that's going to be legally compliant, but what's going to allow those individuals to play with confidence and not, there's a lot of fear out there, justifiably so. So we need to, we're following the studies, we're following the regulations, but how are people feeling? We need to take that into account as well.
Absolutely. And what does a good workplace look like? I'm just going to double check and see if there are other questions that have come in. We've got messages. And have there been any studies examining the effectiveness of instrumentalist vocalist masks working versus normal non-medical masks?
I am not aware of any as yet, but it would be a great one to be exploring. But I haven't seen anything come up. Maybe someone else has.
But I think one of the things I'll say is that the instrumentalist mask, at least the one for instruments that you insert in the front of your face, is they actually have a split in them. So you're not putting the instrument up under the mask, you're going through the mask. So that's potentially the difference.
All right.
Okay.
I think this would be a really good time for us to take our little break. I know you've all been sitting listening to me and the fire hose of information for a long time now. So I'd like to ask Royden in a moment to put up his countdown timer, his magical countdown timer. And I'm just going to draw your attention to the day of visibility that's coming up on the 22nd of September. Hopefully that's something that we can all get behind, put a little red light bulb in the window, and remember that so many of us are affected and will be for some time. And this is just a way to try and make those numbers more visible. So I'm turning it over to Royden, and I'll ask everyone to mute, take a break, have a stretch, have a drink, and come back in 15 minutes.
Deep fried Mars bars are on their way via drone. Thanks, everyone. See you back here. So it looks like we're back in business. Welcome back, everyone. We'll just have to get you unmuted, Janet, and away we'll go.
Okay, I am unmuted. I'm going to ask Royden if he's able to share the screen for that little AGO video. Is that possible for you to put that up now? There we go. It's only about 30 seconds long. Okay, you can let her rip. Thank you. I think that's just kind of one of those things that's kind of sweet to see people, how they can sort of approach this with some creativity. And they've got also some really nice little graphics that they put together, which I think are quite creative. So, you know, just some ideas about how people are sort of managing and how they're communicating. So what we're going to do next is we're going to do a short risk assessment activity, and I'm going to show you the form that I've created for you to work with. So this one is another spreadsheet, and we will approach it in the same way as the last one, where there will be one sheet for each group. And I'm going to ask Royden to put that link into the chat. So just to show you what I'd like you to do with this is to go, we'll be going back into your same groups, as far as I know. And so I want you to choose a venue. So it could be a place where your orchestra plays, or you could choose a section. So you could just decide, we're going to talk about brass. And within that, I've listed some activities, some things that you need to take into consideration: dressing rooms, washrooms, warm-ups, breaks, rehearsals, and performances. So from the list of hazards above, you can select, you can just copy and paste some of the ones. I've given you a few more lines in the other one, but we're not looking for pretty here. We're just looking for a conversation. So maybe you want to look at brass and you're not really concerned about dressing rooms and wardrobes, but you want to really talk about rehearsals. What are some of the hazards that you're going to need to address? And what are some of the controls? Is it going to be about placing people 2 meters apart, masks, increased cleaning, reduced number of people handling stands and chairs and scores and all of those kinds of things? So here's what we're going to do. So you'll then, once you've picked, you know, what, and you can work on whatever piece of this you want, but let's say you want to do rehearsals, you pick out some hazards, and then you develop a list of controls. And you may only get through a couple of them. That's okay. I just want you to have the opportunity to give it a whirl. So moving on, here's the instructions. Again, you'll have someone to fill out the Google Doc. You're going to go open the sheet with your group number, and that's what you're going to do. So the link should be in the chat, and then I'm going to next ask for Royden to send everybody back into their groups.
Just FYI, Janet and everyone, the groups will be a little bit different because the numbers have also changed during.
Oh, that's all right.
Before, yeah. So you might
now
see
you get to meet new people, so you're going to be adding to your personal panel of experts.
There you go.
During this one as well, and we'll just take 10 minutes for this one.
Sounds good.
Thank you. Well, welcome back, everyone. I hope you had a valuable conversation with your peers, whether or not it was about your situation you're grappling with or whether you were actually focused on the risk assessment. Either one is fine. This is your time to use as you find valuable. So the risk assessment is sort of one component of what I would look at as an overall assessment. When it comes to reopening our orchestras and our venues, another component is looking carefully at the venue. I recommend a venue audit, and there is a wonderful tool now available for that, which I'll be speaking to a little bit more when we get back to looking at resources. But I'll give you a sneak preview that the National Arts Centre has just recently published a really excellent series of tools that can be used for this type of audit. You want to be considering your capacity for all the different folks who will be on your site throughout the building. And you want to be accounting for physical distancing during activities such as ingress when they're coming into the building, circulating throughout the building, egress when they're leaving, and also emergency egress. So we have some information that will help us to determine our capacity. Many organizations are beginning to look at that, although they may be some time away yet from reopening, but there are a few factors involved. The first is your locally permitted maximum gathering size, and the second is the physical distancing requirements based on the layout of your venue. So depending on how your seats are positioned, how many aisles you have, how deep, how many exits, all of those things will affect how easily you can get 2 meters of distance between each person. The lower of these two numbers is going to be your patron capacity. So if you have a permitted gathering of 100 people and your venue has 1,000 seats, your patron capacity is 100 people. If you have that same permitted gathering of 100 people, but you only have a venue of 250 seats and your physical distancing allows for 50 people, then your patron capacity is 50 people. So it's a really difficult challenge because the only way to gather more people together is to put them in more space. And you're going to experience that in terms of your rehearsal space, your stage sizes, dressing room areas, all of those need to be considered. We'll also need to make some assessment of programming. So really thinking about the kinds of programming that can realistically be presented safely, starting usually with something that's either a solo or a small group performance. Many of us have already seen the kinds of alternative programming that have been put into play over the summer. Outdoors, drive-ins, live streaming, pre-recorded. Some people are suggesting there might be an option for virtual reality. I'm not sure about that. And other digital experiences. And then you'll need to think about design. Now, design is not likely to be such a factor as it would be with theater or opera, but it's something that you may need to consider as well. So we've completed a variety of assessments. We've done a risk assessment, we've looked at our venue, we've looked at our programming, and now we're finally ready to take the step of preparing a healthy workplace. At the beginning of that is recognizing sorry, I'm beginning to jumble my words, recognizing the employer duties to provide a healthy and safe workplace. As we begin this task, it's a good time to consult with worker groups, associations, and unions, and volunteers if you have those. What do they need to feel safe to return? Consider people who may be vulnerable due to age, pre-existing health conditions, etc., and develop precautions for each of those activities. So within the risk assessment activity, you made a start to that. All of these precautions, policies, and procedures will be compiled into a COVID-19 safety plan. Many of the jurisdictions have templates for a COVID safety plan. WorkSafe BC in British Columbia has a particularly good one, and they also have that available as an app where you can just it organizes it and you just add the data. When it comes to your policies and procedures, you will have some that are very general. You have some that are specific to individual groups or departments, but I encourage you to consider the life cycle of the show. So consider everything from your pre-production phase all the way through to the strike, including rehearsals, performances, tech work, and so on that may need to be done. And consider the daily journey of each of the folks who are going to be joining you. So they park their car, they come into the building, they take their instrument out of the case, they play, they take a break, they have a drink of water, they pack, they go. All of those steps in their day need to be contemplated. When it comes to implementation and compliance, you need to be very clear about consequences for non-compliance in advance. So that question that came up about, what do you do if you have someone who declines to wear a mask? You need people to read and agree to follow guidance before they are allowed to join you. It's up to supervisors to enforce compliance, which means they have to really have a solid understanding of all of that guidance before you begin to welcome people back. Considerations around time, people, and money. We've got some things we can do with our schedule. We can stagger shifts. We can stagger patron arrivals. We can institute a maximum performance time, a longer intermission or no intermission. So I've talked to one venue that was planning for the fall, and they were going to have maximum performance of 75 minutes with no intermission. But they were also looking to acts they could bring into their municipal venue who would be either solos or small groups who were ideally part of a small group, like a social circle or something like that. Eliminating an intermission means you don't have to worry so much about your washroom access. That's even better if you're not selling gigantic drinks. But, all of those things that we sort of think about schedule that we think are carved in rock, we need to begin to think about those in a more flexible manner. Staffing, we may need to provide additional roles for cleaning, screening, supervising physical distancing, and managing lines. We may need to have a person, if we're going to have an intermission, who is making sure that, 2 people go into the washrooms and then 2 people come out and 2 more people go in, and taking some of that care. When it comes to our staff and our volunteers, we really need to establish that there will be no penalty for reporting illness, that people must stay home when they're sick. This is really, really challenging when people have been away from work for a long time and finances are, a lot of us are struggling around money. So I encourage organizations to consider paid sick leave. I know that's a big challenge, but when people are struggling financially, there is a huge incentive to go to work. And we need to make sure that that's not happening if they're sick. Again, considering those vulnerabilities. Budget, you've got some additional costs you may have to account for. And then once you've looked at all those variables, you need to allocate the appropriate resources, whether that be budget or staff. If you are a venue, or if you operate a venue, you need to be connecting with all of your clients, your licensees, renters, contractors, review contracts. It's important when there's a bunch of different parties involved. So you may have a venue operator and an orchestra, which are separate entities. Clarify who is responsible for which tasks related to health and safety. In any new agreements, include new responsibilities and the authority to carry out and enforce them. The clients, people coming into the venue, want it to be very clean, and the employer or the venue owner wants to also know that the client is not going to bring some kind of unreasonable risk onto their premises. So both parties have a vested interest in keeping people healthy. Communication and training, you need to be able to communicate all of the new policies and procedures by educating your patrons and your workers. And by workers, I also include the volunteers. Procurement may be about figuring out, where do you get all the barriers and signs and PPE that you need? That's one thing you can be doing now, even if you're not ready to actually, spring into reopening straight away. And I encourage you to really take time to monitor and evaluate. Survey your artists, survey your workers and patrons. Did they feel safe? What went well? What needs improvement? Identify areas of concern, respond, change, and update as needed. That can be as simple as a little survey monkey, few questions that you put into an email, but you will get good information back, and people feel confident when you've asked them and when you respond to what they have raised as concerns. Okay, so now I have a little activity. It's I'm going to ask Royden now to put the link into the chat. Having considered a whole bunch of planning activities and risk assessment, I want you now to just take a moment to reflect on what things come to mind as challenges. What things do you sort of think, oh, you know, we should do that, but that's going to be really tricky. And I also want you equally to think about what could be opportunities. And there's two ways that we're going to do this. One of them will be you will open the link in the chat and you will enter the information. It will be anonymous. Or you could just enter things into the chat. So this little image at the bottom, this is a sort of a little tool. It's called Fun Retro. And this is for a different session I did where I had asked people what are the best resources they were finding and what were resources they needed. So when you go to the link, you'll hit on a plus sign, and underneath challenges, jot out a few notes about that. One per item. You could put in as many as you want. So one example would be, you know, we think that we will solve all our problems if we put space helmets on our conductors, but the challenge is that would be very expensive. An opportunity might be if we're not having any patrons, we're saving money on ushering staff, but it can be really anything. What's coming to mind to you now as part of these conversations? So if you're not able to get to the link, or if it's just easier for you to use the chat, just identify something with a C as a challenge or an O as an opportunity. So you can go there now. And Royden, are you able to share a screen to pop that up so we can see it?
Yeah, sure. I can share it now.
Fantastic.
As the answers are coming in. Okay.
Not sure how I can see it. Maybe I need to just close out my. I don't want to. Oh, there they come. Fantastic. So what's really great here is that seeing these challenges can help you to, you know, understand that the things that you are grappling with are something they're shared across the other orchestras who are you know, trying to get reopened as well. So I'm just going to read out a few of these. You know, we have rehearsal space and concert venues have their own rules. Yes, so that can be tricky. It's something that needs to be navigated. Of course, everyone wants to keep the vulnerable folks safe. PPE may be a challenge, you know, in certain, figuring out exactly what you need and where to get it. You know, sourcing plexiglass shields. Really hard to keep people from getting complacent. I was at a family gathering where we had all been tested. It was a small group. We had all been living very very, limited. And all of a sudden we get together and the 2 meters sort of went out the window. So that was a surprise. I wasn't expecting that to happen. It's hard to keep track of all the new information that's coming out. It's hard to figure out how to deploy the brass and woodwinds when, there aren't activities that they can participate in. Access to venues that are open and will let you go into them. That's tough. Equitable workload, remaining flexible, extra volunteers, having much more work for our board member volunteers. Wow, no paid admin staff, that's tough. So there's, contact tracing, low income. Yes, how do you have revenue with such a restricted attendance limit? Patrons who are seniors and members as well. Yeah. Here's a good one. Maintaining an artistic direct integrity while physically distanced behind physical barriers. Funding, lots of funding. Insurance is challenging. Insurance is, there are some things going on with insurance and not-for-profit that are really difficult right now. Okay, so there's a lot of challenges, but boy, oh boy, there's also, look at that. We've also got a lot of opportunities. Saving money, implementing online digital dissemination. So that's definitely gone forward. In-depth conversations, other roles for players. Yeah, fantastic. Yeah, it's an opportunity to take advantage of staff skills. I mean, I feel kind of bad that I'm taking advantage of Royden, who is a composer, and he is, he's keeping busy supporting a webinar like this, but it's a delight to have his help. Yeah, and strangely, it has brought lots of people closer together. It has made us appreciate the need to come together and share music. Certainly, the big thing I've learned is there's some cool digital content out there, and all it makes me want is for the real thing. It makes me want to see live. Fantastic. Okay, so I'm going to take a quick hop over to the, yeah, looks like everyone's managed to get in there. So thank you for that. We'll save that, and we'll come back to it towards the end, because I have one other activity that we're going to do that will involve that. So let me come back into sharing my screen like magic. All right. Okay. So that's really good. It's helpful to pause and reflect on what are the things we need to figure out and what are the things that we are actually gaining from this. And I want you, before we wind up, we've still got a little bit of time, but I want to go through some resources. First and foremost, you need to consult your local public health requirements, and you're probably all doing that very regularly. I encourage you to evaluate your information sources to make sure that what you're reading is credible. So they need to be current. The reality is that as we get new information, guidance changes. It's not because it was wrong before, that's just how science works. So some people have sort of been very angry because in March, government was saying you don't need to wear a mask. And now face coverings have been discovered to be really, really valuable. So we have to accept that things are going to change. We need to be looking at local information. By all means, reference global guidance. I do that a lot, but when it comes to compliance, it needs to be local. So you need to double check and make sure that you're looking at guidance that refers to your area. And it also needs to be relevant. So within the resources list, I've tried to include a bunch of different resources that are related to arts and culture guidance. But I also encourage you, depending on your activities, to look to guidance for, if you have food and beverage, see what restaurants are doing. If you're selling merchandise, what's retail doing? Look at other types of attractions and gatherings. I'm certainly looking at even sport to find out how are they managing dressing rooms and those kinds of things. Be cautious There are a lot of studies that are being published quickly, often without peer review. And by published, I mean posted, not formally published yet. But there is some magical thinking, and there are some unreliable online resources, which we all need to be cautious about. When it comes to looking at my favorite resources, I'm going to start off with a brand new one. This one just came out on September 1st, and it's from the National Arts Centre, and it's a set of tools to support a safe reopening for the Canadian performing arts sector. What I really love about it is it does take a risk-based approach, and it has a lot of tools and best practices to help look at everything from contract negotiation, rehearsal, performance, and everything in between. They've focused how they have organized this information according to 3 key actions: auditing, communicating, and adapting. So that one's hot off the press, and I really encourage you to dig into that. It's going to give a lot of good advice for organizations of all sizes. They've done a really tremendous job. They've consulted with a lot of performing arts companies. And next, I'm going to go back to one which was really first out of the gate. This Event Safety Alliance Reopening Guide was a document that I was a contributor to. Now, that sounds grand, but there were about 300 of us. It was crowdsourced and then edited by Steve Edelman, the vice president of the ESA. And I still go back to it because it's got solid information. It's not particularly attached to a time, in that it doesn't, the information doesn't really go out of date because it's not referencing specific capacities or gathering numbers, but it's nicely organized and it has some really good information that can be adapted. There was also a group of folks from the community theater world who took that document and adapted it into an Ontario version that has a lot of great tips about volunteers. So if that's something that might be helpful to you, shoot me an email and I'd be glad to forward the link for that. Actually, it's not a link, it's a PDF. ActSafe in British Columbia is the only safety association in Canada that is specifically focused on performing arts and the film and television industry. So they've come up with a bunch of risk assessments type guidelines for a lot of the things that we need to be involved with. Everything from audience services through live streaming guidelines, performers and clients, rehearsals, working remotely. So they've got a little guideline for sound check, which is handy. So dig into those, and I think you'll find some good stuff there. The Guide to Reopening Theatrical Venues is an American document. It was fairly early, it was May 15th. And again, they've got some really good info. I particularly like their risk assessments. Now, it's really focused on a performing arts center, more of a kind of roadhouse setting. So it talks about visiting company and back of house staff, but really the focus is more on the sort of patron front of house office side. But I do think you'll find some really good information under the risk assessment section. One of the things that I like about it is the way they've laid out the controls, but also they include impact. So is this going to be more staff? Is this going to be more money? And that could be helpful information. And finally, the final one that I should have taken out the new, because there's been new ones since, but the IATSE Stagecraft Recovery Plan came out on July 22nd, and they do very well with all of the venue and craft specific guidelines, but you will still find some useful information for musicians, specifically, things around stage door entry and but all of the back of house, front of house, and shops. So I encourage you to look at those ones. And all of the links for these documents are found in the resources list that I have sent. So you're thinking very long and hard about how you're going to reopen, and I want to encourage you to take baby steps by starting gradually. Many of you may already be back to the office. You may be including a few small numbers of workers in other departments. You may have some tasks they can be carrying out, but it's important to make sure your new procedures are going to be effective before you begin to invite patrons. Plan for the activities you can reasonably accomplish safely. So that might include a small reopening to test your procedures. It could even be an initial rehearsal. Build confidence in your health and safety measures. Communicate what you are, what people should expect and how you're adhering to the health requirements. So whether it's your musicians or your patrons, people are going to want to see visible evidence that you are doing the right things and that you are committed to following through. So, you know, having information posted at the stage door or having something on the glass before they go into the building, maybe having something at the rehearsal room entrance. People really want to have that reassurance. So when you've reopened, after that, post-reopening, conduct surveys, review the information you get, make changes. Also watch what's happening other places. One of the things I think is most valuable about getting together today is to see how many people are working on the same challenges that you are. Hopefully you can connect with them, email them, set up more calls, share information. I think you're going to get the best information from each other. You are experts. You need to own that expertise because I know you're really capable of putting together the right types of protocols. But, you know, we are looking at a difficult fall. People are going back to school. We are getting into some cooler weather, certainly where I live, where people will be moving indoors. And we are already seeing an uptick in cases. We need to be prepared to pivot and shut down again. I know that's hard to hear, but we need to have that in mind. And when we begin to invite patrons to concerts, we must get it right the first time or the whole industry will be affected. There was a club in Toronto that before the gathering sizes had been expanded to the vast number of 50. When we were back at 10, there was a nightclub that opened and had a whole bunch of people inside, and they were shut down and there were charges. And that really casts a pall on that whole industry. And we can't afford for that to happen. Everybody needs to be similarly compliant. So what is our new normal going to look like? I'm getting tired of those words, but the reality is we're still in the acute phase. We are pre-treatment, pre-vaccine. The reality is physical distancing is likely to be needed for months, perhaps years. Masks and face coverings, same thing. I was really hopeful back in about April that, wow, this is going to blow over and by September, people will be doing shows again. And that's not the way it's playing out. There will be some things that should be permanent changes, things that we can do now to protect against the second wave of the virus, as well as seasonal flu and the next pandemic. We can do things about our programming. We can be ready to pivot to smaller activities. With our operations, we can move into some more no contact payment systems, automatic doors, when we're eventually ready to bring back food and beverage. There are apps that will allow people to pre-order or order from their seats. And within our venues, if we're able to do reorganization and renovation now, we can plan for healthier ingress, circulation, washrooms, and egress. I know that's not an option that will be available to all, but if you are in a situation where you go, you know what, the building's empty, we have some money set aside and we can do this, this would be a good time. So now I'm going to share with you my wish list. I'm even going to show you a wishing well. So my wish list for orchestras is that we receive acknowledgement from public health and from other levels of government that live music is not all the same. We have lots of different types of live music. I've listed some examples. Ranges from an orchestra in a large concert hall, a ballet orchestra in a pit, a single folk singer on a patio, a choral concert in a church. They're all different. They all have different risks. And I would like to see us move towards flexible requirements based on the specific risks for a venue, an organization, a program, and the artists, the musicians. My wish list also extends to wanting to see research, which has begun but not completed, on droplets and aerosols to really determine what a safe distance between singers, woodwind and brass players and others would be. I'd like to see increased gathering sizes, indoor and outdoor, similar to houses of worship. I know in Ontario, with the uptick in cases, they will not be considering any increases at this time, but I hope there will come a moment when they will. Increased venue capacity. So when science supports a reduced distance, you know, if there is some point where science will say, okay, we can go from 2 meters to 1.5 or 1 meter of distance, that will allow additional capacity in our venues. I really, really want to see clarification on barrier requirements in Ontario. So right now, the requirement is there is an impermeable barrier between the stage and the audience. There are no specifications as to what that should be, how high it should be, how it should be fabricated, whether it needs to cover the entire front of the stage. I've been asking those questions at the Ministry of Labor level. We have yet to receive any reply. We want to know whether, you know, whether there are requirements. At the present time, there are not, but whether it's desirable to have barriers between certain artists and what size those should be. And can those barriers be replaced with increased physical distancing? So that's my wish list. Those are the questions I would like to see answered. In terms of summary, I want you to remember that your reopening needs are, they need to be, your plan needs to be as unique as your business, as your organization, as your orchestra. Be realistic about your ability to resume. It's going to take time and you're going to need to adapt. Within the arts and culture community, creativity and problem solving are our superpowers, and they're needed now more than ever. Remember that we need to keep our artists, our workers, our volunteers healthy, and we need to create environments where patrons feel comfortable to return. So now I'm going to ask us to go back to that link, and I want you to, some people have already begun, but I want you to now reflect on what action you can take. It doesn't necessarily need to be a huge action. It could be that you're going to review the resources. You're going to look into bell covers or instrumentalist masks, or you're going to plan a meeting with your board, or you're going to do a Zoom call with your musicians. I'd like everyone to leave this session today with at least one tangible thing that will help you to feel that you are moving forward. And at the bottom of this slide, I've included a note that I use with all my students. And I say, if you can't afford to do it safely, you can't afford to do it at all. So I'm going to jump out of my screen share. I'm going to ask Royden to take us back into that lovely little fun retro thing. And let's have some moments of figuring out what can you do? What do you want to do? Because I know that all of you guys are doers. Grant applications and chasing sponsors. Lots of searching for money and funding. Great. Online and digital internal, external communications. opportunities for cross-sector collaboration. That's brilliant. One of the things I've been talking to venues about is that I would love to see more collaboration. Many of the big venues, they're not going to be able to have huge shows in their venues at this point, but could they keep their venue alive by offering it a reasonable amount space to some smaller group that might be able to, benefit from the space. So I'm hoping that people will begin to think more in that way. I think the industry as a whole needs to really think about collaborating and cohesive protocols, because it's not helpful to be competitors in this climate. Lots of research. Fantastic. More grants. Oh, I so wish I could sprinkle grants about like confetti right now. Oh, here's someone who has already done risk assessment and planning. Wonderful. These are fantastic. Okay. I think I'm just going to have a look. So really the main thing that I want to do is, I know we've just got a few formal minutes left, but I am happy to stay on longer if possible. I mean, if anyone else wants to stay. I have time to answer some questions now. And I would also ask Royden to pop up our final poll. And what our final poll is for is to revisit that question about how you're feeling. So let's have a quick look at that one. All right, so the results are coming in, and there's still a very high level of concern, certainly a good deal of stress as well, but I feel like we're seeing more optimism, maybe a tiny bit more excitement, and I think a little bit less confusion. So we'll just give one more second. Yeah, I think that's good. Let's end the poll and we can see the results. Okay, thank you, Royden. So what we've got here is, yes, we've still got quite a bit of concern, which is normal, which is appropriate right now. But I think we're seeing more optimism as well. And dare I say, more excitement. So I'm excited to see this, the orchestras begin to come back, and I hope you are too. I'm going to just throw it back to Catherine and see if she has any questions for me.
So I'm just going to scroll back through chat. I've been keeping a pretty close eye on it as we've gone along, and there's been some great sort of exchange of resources. So we will harvest the chat, and that will turn into part of our report back to you on the meeting, so that you don't have to harvest the chat yourselves. I know that Janet was also very interested in what was there. So I'm just going to pick up a few comments rather than questions, and there may be some other questions as well. Chris Walrath has noted that Kerner Hall in Toronto requires masks at all times, as well as a 2-meter distance, and even if there's no audience present, wind and brass players must be behind a plexi barrier and can only take their masks off when they are behind the barrier. So those are internal restrictions at Kerner Hall that are well above and beyond the provincial guidelines. So just important, I think, and this came up in Chris's presentation earlier, is the importance of working closely with your venue on what their requirements are. So it sort of sounds like the local
Mm.
thing is your venue, next step up is public health, then it's the provincial guidelines. And all of those things need to be part of what groups are taking into consideration. And comment
I
that
think we
no one
might have
can.
worn them out.
Well, as I say, it's been pretty lively in there. I think one question that I will put to you right away, Janet, is we've had some enthusiastic interest in the community theater version
Yes. Okay.
of the reopening guide. So
Okay.
definitely keen interest in getting our paws on that. I will also say that that risk management spreadsheet that you had with the additional columns,
Oh, yeah.
we'd like to get our paws on that as
Sure.
well, just for general planning purposes, that would be tremendously useful.
Okay.
Just going to check and see what
I
else.
have to be honest, I left those columns out because sometimes we go down rabbit holes. I do teach risk assessment with the school programs I do, and we can spend a lot of time on, is it a 2? Is it a 4? What if the entire building burns down? What if just one actor catches fire? You only gave me 3 hours, so I couldn't go down that rabbit hole.
Right.
But I
No,
will send you a sample document that people can use, and I will send you the community theater guidance. They've done a really good job with it. I have it as a PDF. They're sharing it among community theaters, so I'm sure I can share it. It'll just be as a file as opposed to a link.
That's fantastic. And again, driving people back to that same resource page on our website where we've already got a number of things posted. We will be doing an edited version of today's webinar. We might slice it into bite-sized chunks. We'll have like
Good idea.
The year-long podcast series, 100% Janet Sellery. Your Janet Sellery of the day for 365 days, whatever. But we'll come up with an elegant way of sharing the sound file, and people already have access to your resources list, the worksheets, and the PowerPoint deck in both official languages, may I add. So we'll just make that the center of action as well. Royden has graciously agreed to put together kind of a top 10 listicle. In our efforts to go viral, we'll come up with something along those lines to share major learnings from today. And I'm going to highlight in the 30 seconds that I have left something that's come up, and that is the conversation around provincial regulations, local health unit requirements, and the level of comfort of artists, workers, and patrons. And exactly how to balance those things in a way that respects the science as well as people's feelings about what will make them feel safe. And I think we just have to work with that and acknowledge that workers have a big, they have a lot of skin in this particular game. So does management, so do the venues. So there we go. I think that may be it for now, but Janet, we know where to find you.
You do.
And I think everyone on this call knows where to find us. One other thing that I will say from Nancy from the Stratford Symphony Orchestra, very few people could deliver such a long workshop as well as a stage manager. Okay, so yay, stage managers of the world. Okay, I'm going to pull out the reaction button. I'm going to put a thumbs up and I'm going to clap. How's that?
Hurrah! Hurrah! Can I just jump in and pass on my thanks to Catherine for the invitation, and also Royden for all the support. He's been redeployed to make all of the links and the chat and the screen share like magic, and I hope he'll be released back to composing music as he should be very soon. But it's a great pleasure for me to have time, even though I'm mostly looking at my computer screen, to pop into those breakout rooms and hear the level of passion for what you do, the care and concern for your musicians, and the yearning to get back at music. I'm happy to support that in any way I can. And I miss it. And I wish you all the best as you work your way through these particular challenges.
Well, as
Thanks
someone
for having
commented in the opportunities area, the opportunities for connection with people that we wouldn't otherwise have connected with is one of the gifts of the pandemic. I'm not, in any way indicating that any of this is easy, but the opportunities that it's provided with us to learn from someone as good as you. I'm not going to say it's made the pandemic worth it, but you've certainly shone a light for us, and we are all deeply appreciative. So thanks, everyone. Watch this space, and we look forward to engaging you in our work as we move forward. Thanks again. A wonderful afternoon, and let's go get them. Thank you, everyone. Huge thanks. Bye now.